Okay, so where we left off last time, you were back here working on the shoulder region, and you may have a little bit of work left to do there, maybe finding the nerves in the triangle or the quadrangular space. If you have any work to do there, go ahead and do it. But then the next thing you should do is turn the body to the supine position, because we're going to be working in the axilla today. You'll want to go ahead and remove any skin on the arm to the elbow. This should be pretty quick and easy work. The skin of the arm is kind of like a sleeve, so when you get the plane right, it comes off pretty easily. And then you're going to want to pull the arm back, and this is something I can't do in the model, so this is going to be a little bit more of a constricted view than you'll have in lab. But I'll want you to pull the arms back, and we'll provide rope in the room that you can use to tie them back if they don't want to stay back. But that's going to be an important first step to set the stage and work in this space, because it's a pretty cramped space if you can't pull the arm back. So let's first look at sort of this is somewhat of an approximate view of where you left off last time when we were in the axillary or in the thoracic region doing the anterior wall dissection. We found the axillary artery and vein. Maybe the lateral cord of the brachial plexus as well as the medial cord. These we found like in the very first dissection. So like just familiarize yourself with those structures again before you get too far into this business. And then a really good place to start is just sort of, if you can, push all that stuff out of the way and start just pulling out fat. And I would suggest using your hands as much as possible for this. Definitely do not use a blade in this dissection at all once you have the skin of the arm removed. This area has a ton of fat in it, and the sooner you get that out, the easier your work's going to be. But if you can get as much of the fat out as possible to the point where you can actually visualize these muscles that form the different walls and surfaces of the axilla, that would be great. You should be able to see the latissimus dorsi, which was here on the back, but now we can still see it on the front, forming these sort of wings. The serratus anterior, which we saw before, on the chest wall, forming the medial wall of the axilla. Way in the back, we should be able to find the subscapularis muscle, which is on the anterior surface of the scapula. And then the teres major is also visible in this space. It looks a lot like the latissimus dorsi, but they are distinguishable in this space. They both have essentially the same path, crossing to the anterior of the humerus and attaching right up here, and this makes them both medial rotators. So if you could just take a minute and get all that fat out, get to the point where you can find those muscular structures in the axilla, that's going to help out quite a bit in our work. So let's go back to this sort of space, something you might find right away on the deep surface of your pec major and pec minor. They're going to be reflected meaningfully as we did last time, not like clear over here. But on the deep surface of those muscles, you might find some nerves. And on the deep surface of the pec major, you might want to look for this lateral pectoral nerve. This will be on the deep surface of pec major only. And then on the deep surface of pec minor, you might find the medial pectoral nerve. This one also goes through the minor and then also supplies pec major. So pec major actually gets both, but if you're looking for them on the deep surfaces of the muscles, that would be the ones to look for. So this sort of shows that medial pectoral nerve going through the pec minor, and then it would be going to the pec major. So then let's sort of zoom into this space. The pec minor is a helpful landmark because if we look at the axillary artery right before the pec minor, there's several branches coming off of this thing called the thoracoacromial artery. This is the artery that emerges from the axillary artery just medial to the pec minor. It's a really reliable landmark. And there's multiple branches of it, you don't need to know them all, but just find that thoracoacromial artery or thoracoacromial trunk that is coming off of the axillary artery in that space. Let's see what's next. Then I guess we're sort of backing up to this space, pulling out the pec minor, and then I think an important thing you do before you go any farther in your dissection is remove all of the axillary vein and all of its branches. If we have one less structure in there, this is going to be a lot easier to deal with. So after that's out, it's probably time to start looking at the nerves of the brachial plexus. If you can just sort of squint your eyes a little bit and visualize this M-shaped structure that you see here, the letter M that's laying on the axillary artery. This is the most helpful telltale sign or shape that will point you in the right direction for the brachial plexus nerves. Musculocutaneous, median, and ulnar nerves. And these three nerves just happen to be pretty significant nerves in the upper limb, so it's a great place to start for many reasons. But if you follow the median nerve backwards, it splits into two parts. One that connects to the lateral cord, clear up there, and then one that connects to the medial cord, clear back here. So take a minute to follow those back and connect to those lateral medial cords. These we might have actually found a while back in the first dissection, the lateral medial cords. If you look way up in the lateral cord, you might actually find where the lateral pectoral nerve comes from it. That's where it gets its name, lateral pectoral. And the medial pectoral nerve, you might be able to see it connecting down to the medial cord. So have a look. There's also some other branches of the lateral cord and the medial cord. Those would be best demonstrated on your cadaver, not in this sort of compressed anatomical space that we're looking at here. I highly recommend having a schematic figure from Grants or Netter's open, and just do your best to use that schematic to approximate what it should look like. I have never found a axilla that could not be reasoned using a good schematic. So let me just go back really quick, just 1 second. So this is here where we left off. We had the artery and we had all these nerves around it. You should be able to grab all of these nerves of the lateral cord and the nerves of the medial cord and the axillary artery and its branches and sort of push them superiorly in order to find what's behind them. Because there's actually a third cord called the posterior cord, and that is basically tucked behind the axillary artery. So you have to push these things out of the way. There's three branches that come off relatively high near the subscapularis muscle, and one's called the upper subscapular, the lower subscapular, or superior and inferior. I like upper and lower. And then there's a middle subscapular that's also called thoracodorsal nerve. This thoracodorsal nerve is so named because it goes all the way down and supplies the latissimus dorsi muscle. So thoracodorsal in your mind should be equivalent with latissimus dorsi. If you go back to the posterior cord, there's two more significant branches. There's the axillary nerve, which goes back through the quadrangle to the deltoid, and then there's the radial nerve, which we found last time in the triangular interval, but we can find it passing through the axilla here. So take a minute with those posterior branches. Those are probably the harder ones, just because you have to get some access to push them all out of the way. But once you get them clean, they'll probably look just like the book. The last branch of the brachial plexus actually isn't a branch of the brachial plexus at all. This is the nerve that supplies serratus anterior. It branches from the nerves of the ventral rami much earlier than the actual formation of the plexus down here. So you can follow this nerve. We're not going to do this, but you could theoretically follow this nerve clear up all the way where it branches off the ventral rami way up in the neck. But this nerve, long thoracic, is the supply to serratus anterior. So if you clean up the surface of this muscle, you may actually just see that nerve laying right there. It's usually a quick and easy find. Okay. So then we're turning to the anterior arm. We want to also do the anterior arm and posterior arm. These are relatively simple compartments that have a small number of muscles in them, so we're going to do them today. And then in the next session, we're going to conquer the forearm and hand where volume and numbers abound. So if we look at the anterior arm, we're really just looking at three muscles. The brachialis, which lies flush against the humerus. The two heads of the biceps, short and long head. And the coracobrachialis, which is this muscle right here that lies right next to the short head of the biceps, runs from the coracoid process down to the humerus. This one's sort of notable in that the musculocutaneous nerve typically passes through it. So have a look and see if that's the case in your cadaver. If you push the biceps muscle out of the way, you'll be able to see the musculocutaneous nerve as it passes all the way through the anterior arm, and then you'll see it as it emerges. I'm going to go back really quick, and so you can see it peeking out right down here. This is what used to be the musculocutaneous nerve, but now that it's left the anterior arm, it's changed its name to lateral cutaneous nerve of the forearm, because it's got some work to do down there in the skin. So we want to follow these nerves that we find in the brachial plexus, follow them down through the arm. Let's see, I think there's some on the other side I was going to show you as well. Let's go over here. Yes. If we go to the medial side of the biceps, you can also follow things like what used to be the axillary artery and now changes to brachial. You can follow that clear through the arm down to the elbow. You can follow the ulnar nerve clear down to the elbow, and the median nerve as well. The one nerve that you're not going to be able to follow all the way in one view is the radial nerve. This one passes posterior, and this is where we found it last week in the triangular interval between the heads of the triceps. So we want to turn the arm over. We might be able to just pull the arm across the chest and do this without turning the cadaver. And then we want to take the lateral head and section it, oops, here, let me just do this really quick. Okay, take that off, go back. Sorry about the crazy ride here. I promise it'll be worth it. Alright, so we're going to section it and pull the lateral head, at least this portion of it, away. And what that's going to do is show you the path of the radial nerve all the way through the posterior arm down to the elbow. This is also going to let us see the medial head of the triceps, the third head. So we had long head, lateral head, and then medial head is down low, right against the bone. So we'd have to have this reflected in order to see it. So that would be the very last thing that we do today. So just to sort of summarize, we're going to try and identify the muscles of the axilla, the muscles of the anterior arm, the muscles of the posterior arm, and then we'll identify the nerves of the brachial plexus and follow some of them down through the arm and see how they approach the forearm. And that'll set us up for next time when we continue those stories in the forearm and hand. All right.